Hello friends, welcome to my channel Pathology Master. Hope you are all doing well. Myself Dr. Parth Goswami, I am the consultant pathologist, and today I will teach you one important topic from hematology, that is the red blood cell indices. Now before I start my discussion, I want to ask you that have you ever seen your CBC report? In your CBC report you might have read that the pathologists have written certain values like that of MCV, MCH and your MCHC so much. So what are they all? These all are your red blood cell indices, right? In your body you have the many type of cells like that of WBC, you have your platelets, you have your red blood cells, right? Every cell is having the different function in your blood, and this red blood cell contain the hemoglobin within it, and it carries the oxygen to the different tissues, right? Whenever such red blood cell will reduce or hemoglobinization is decreased, the condition is called as an anemia, right? Where your organs will not receive enough blood. So such anemia can be diagnosed with the help of red blood cell indices. So these indices will help you in differential diagnosis of different type of anemias. That's why you need to understand it in detail. So kindly see the full video. So guys, our learning objective is to understand what is RBC indices. Then you need to understand the types of RBC indices, which are different RBC indices. Then you need to understand the importance of learning such red blood cell indices. And finally, we will see the MCQs. So guys, this red blood cell indices was first introduced by Wintrob in the 1929. He said that the size or the volume of red blood cell can be calculated with MCV. So the RBC indices that is related to your size of red blood cell, right? Size or volume is your MCV, mean corpuscular volume. The MCV will help you in determining or predicting the size or volume of RBC. And the RBC indices that gives you idea about the hemoglobinization of RBC. Hemoglobin content of RBC are the MCH and MCHC. So these three are the basic red blood cell indices that was introduced by Wintrob early in the 1929. That is your MCV, MCH and MCHC. MCV means mean corpuscular volume. It reflects the red blood cell size, right? MCH means mean corpuscular hemoglobin, and MCHC means mean corpuscular hemoglobin concentration. So these two are related to the hemoglobin content of red blood cell. And finally, one new parameter was added, that is RDW, that is red blood cell distribution width. So now you can understand that there are 4 red blood cell indices. One is mean corpuscular volume, then mean corpuscular hemoglobin, then your mean corpuscular hemoglobin concentration, and finally red cell distribution width, RDW. Now guys, how will you calculate such red blood cell indices? If you want to investigate your red blood cell indices, then how will you collect the blood? So the blood is usually collected from your vein, and we have to collect the 2 milliliter blood in the EDTA vacuum, right? In the EDTA vacuum 2 ml blood is collected, and then you can calculate such indices manually by applying certain formula or with the help of certain hematology analyzer, right? It can be measured accurately by the automated hematology analyzer. This manual method is rough. The formula method is rough. It doesn't give you the exact value. The exact accurate measurement is done with automated hematology analyzer, that is also known by the another name cell counter, right? It can be asked in your MCQ. Alright. So let's start the discussion with the first red blood cell indices, that is your mean corpuscular volume, MCV. So guys, the name itself suggests that these indices is related to the volume of red blood cell, means it reflects the size or the volume of red blood cell, right? It reflects your size or volume. In this diagram, you can see that we can calculate the volume or size of red blood cell. So it corresponds with the volume or diameter of the red blood cell in your smear. So you can calculate it manually as well. The best one is the automated hematology analyzer cell counter, right? You have to run the sample in your cell counter, but that is the best method. But you can calculate with the formula as well. So the mean cell volume is calculated by dividing the PCV to the red blood cell count, right? PCV is divided by red blood cell count, that is multiplied by 10. That gives you your mean cell volume, that is MCV. Normal value of such MCV is 80 to 100 femtoliter. So guys, these indices will reflect the size or volume of red blood cell, don't forget it. So if your MCV value is less than 80, suppose it is less than 80, then your red blood cell is called as an microcyte. The size is reduced, right? So it will called as an microcyte. If it is greater than 100, then the size is increased, right? So that red blood cell is called as an macrocyte. And there are variety of causes for macrocytic RBC and microcytic RBC. The conditions are different. So with these indices, you can estimate that whether you have the microcyte or macrocyte. So if your MCV is low, that is known by the name microcytic RBC, in which your MCV is less than 80, and it is seen in the 4 conditions. The microcytic RBC is seen in the 4 conditions, that is iron deficiency anemia, your sideroblastic anemia, anemia of chronic disease like that of any inflammation, malignancy, etc., and in the beta thalassemia minor. In these 4 conditions, you have the microcytic RBC. And if your MCV is high, that is greater than 100, then it is called as an macrocytic RBC, that is high MCV. And the causes for that include megaloblastic anemia, chronic alcohol, liver disease, hypothyroidism, pregnancy, reticulocytosis, and the newborn. These 2 are the important causes in the micro and macrocyte. In the microcytic RBC, the main important cause is iron deficiency anemia, where you have the iron deficiency. And high MCV, the common cause for macrocytosis is megaloblastic anemia, where you have the low B12 level. So again I am telling, if the MCV is less than 80, then it is called as microcytic RBC, and if it is greater than 100, then it is called as macrocytic RBC. Now this is the picture of peripheral smear, in which we take the blood drop over the slide, right? We take the blood over the slide, and then we will spread it over the slide, and then we will stain it with Romanowski stain, right? We will stain it, and then we will observe it under the microscope. Then we will see it under the microscope, right? So this is your peripheral smear finding in case of an iron deficiency anemia. In the iron deficiency anemia, you have the low MCV, means the size of red blood cell is decreased. You have the microcyte. So guys, you can imagine that there might be subjective variation according to the different people. So for that, uniformity has been formed. You have to compare the red blood cell size with that of lymphocyte, because lymphocyte is exactly having the size of red blood cell. The size of these 2 cells are similar. So you have to compare the size of red blood cell with that of small lymphocyte. Here you can see that all red blood cells are small as compared to your lymphocyte. You can see that your all red blood cells are low, decreased in the size as compared to the lymphocyte. So you have the microcyte. So this is the case of iron deficiency anemia. Okay, this is again the diagram of IDA. You can easily see that this is your lymphocyte and this is your red blood cell. Just see, the red blood cell are very small in size in compared to the lymphocytes. So this is the case of microcytic anemia. Now this is the peripheral smear of megaloblastic anemia. where you have the high MCV, right? So you will observe the macrocyte in your peripheral smear. So as compared to your lymphocytes, see these cells, they are very big, right? So this is the case of macrocytic anemia. So now you can learn that, guys, with the help of MCV, you can differentiate the anemia into microcytic and macrocytic anemia, and accordingly you can predict certain causes. You can reach up to the diagnosis. So this is the most useful indices for differentiating the anemia. But there is always an exception to the certain condition, right? In certain situation there is always exception. So even though you have the anemia, your MCV can be normal in two conditions, that is sickle cell anemia and dimorphic anemia. Why? Because in the sickle cell anemia you have the many abnormal sickle cell red blood cell, right? Abnormal sept RBC are present, many. So your MCV will not reflect exactly whether you have the microcyte or macrocyte. In the dimorphic anemia, again you have the microcyte as well as macrocyte. Both type of cells are present. So MCV will be normal because these two are neutralize each other, right? So your MCV will be normal. So in these two conditions, these two are the exceptions where your MCV will not be useful. Okay, so guys, these indices was related to the size of RBC, right? Now we will see mean corpuscular hemoglobin. So these red blood cell indices will reflect the average amount of hemoglobin in a red blood cell. Suppose this is your RBC, then it reflects the hemoglobinization, means hemoglobin content within the RBC. So obviously, if your hemoglobin level is decreased, right? If your MCH is low, then such RBC is called as an hypochromic RBC. And if this hemoglobin is high, then it is called as hyperchromic RBC, right? The causes for two are again different. So basically, the MCH can be calculated in the cell counter, but you can calculate with the help of formula as well. So MCH is calculated by dividing your hemoglobin to the RBC. Hemoglobin divided by red blood cell count will give you the MCH value, that is multiplied by 10. And normal MCH is 27 to 32 picogram level, right? This is the normal range. So if your MCH is less than 27, then it is called as hypochromic RBC, and if it is greater than 32, then it is called as hyperchromic RBC, right? The causes for hypochromic anemia are the same like that of microcytic hypochromic anemia. These four causes are similarly applied for hypochromic RBC as well. Right? So in this four condition you will have the microcytic hypochromic RBC. This is the most important MCQ. In this four condition you have microcytosis as well as you have hypochromic RBC. Okay. If this MCH is increased, then it is hyperchromic RBC and it is observed in macrocytic anemia. So all these causes can be applied for hyperchromic RBC. So we can say that these four are the causes of microcytic hypochromic RBC and these four are the cause of macrocytic hyperchromic RBC. Okay, so you can understand that if your MCH is low, if your MCV is low, then you can have iron deficiency anemia, means you can have microcytic hypochromic anemia, right? Okay, now we will see third indices, that is mean corpuscular hemoglobin concentration. So guys, this MCH will give you idea about the hemoglobinization of RBC in a single red blood cell. But if we will consider it as an unit, if you want to estimate the concentration of hemoglobin in 1 liter of packed cell, then the indices is mean corpuscular hemoglobin concentration. So it will reflect the average concentration of hemoglobin in the all RBCs, right? It will not give idea about single RBC. It reflect the hemoglobinization in all RBCs in the 1 liter of packed red blood cell, right? So it corresponds with the degree of hemoglobinization in the red blood cell in the peripheral smear. So it's a better indicator of the hemoglobinization of RBC in the blood smear. Obviously it is low. As we have discussed, hemoglobinization is low in microcytic hyperchromic anemia. So your MCHC is classically low in iron deficiency anemia, and your MCHC is high in spherocytosis, where hemoglobinization is increased. This is the most important MCQ, guys. Remember, when your MCHC is high, so your answer would be spherocytosis, and when it would be low, then it is iron deficiency anemia. These two are the very important frequently asked MCQs. And the formula for that is, obviously, this give you idea about the hemoglobinization in 1 unit of packed cell. So the MCHC calculated by hemoglobin divided by PCV, not by hemoglobin divided by RBC. That gives you idea about MCH. For MCHC, you have to divide the hemoglobin by packed cell volume. That is multiplied by 100, and the normal range is 30 to 35 gram per deciliter. So this is the figure diagram showing you the hyperchromic RBC, right? This is the normal hemoglobin. Just see the central pallor, it's very less, but when this central pallor in the red blood cell is increased, here it is increased, right? So they are called as hypochromic RBC. So these are the hypochromic red blood cell, right? If this hypochromic area, right, this central pallor is increased to a very much level, then such cell is called as a leptocyte, right, where only rim of hemoglobinization is seen, all other area are totally white. That is called as leptocyte. It indicates severe hypochromia, and it is seen in case of an severe iron deficiency anemia. So here you can see that hemoglobin within the each red blood cell is very less. This is the case of iron deficiency anemia. The size of red blood cell is decreased as compared to lymphocyte, right? So you have the microcyte as well as hypochromia. Just see, there is an increased central pallor. Just see, the hemoglobin is decreased very much in the red blood cells, right? Okay, so guys, if MCHC is increased, then you will have the hyperchromic RBC. They are called as spherocytes, right? The hyperchromic RBC has given the name as an spherocyte, right? It is called as spherocyte. That condition is known by the name spherocytosis. So in your spherocytosis, you have the high MCHC level. Just see, the central pallor will not seen in spherocyte. Just see these all RBCs. You cannot see the central pallor. These whole red blood cell are totally red, right? Red to pink. Just see, the central pallor is not seen. Normally you have the central pallor in your RBC, but here there is no central pallor. So these are called as an spherocytosis, and this spherocytosis can be seen congenitally as well. That is known by the name hereditary spherocytosis, and it can be seen in certain hemolytic anemia like autoimmune hemolytic anemia as well. This is the most important MCQ, right? In these two conditions, spherocytes are seen. Okay, now we will see our last red blood cell indices, that is RDW. It measures the degree of variation in red blood cell size. So it reflects the anisocytosis, right? So it will help in differential diagnosis of some anemia. It reflects the variation in the size of red blood cell. That is known by the name anisocytosis. So it's related to the anisocytosis. It is high in case of an iron deficiency anemia, and it is low in case of an beta thalassemia minor, and it is normal in case of an anemia of chronic disease. Its normal range is 9 to 14.5, and this is calculated only by the cell counter. You cannot calculate it manually, right? Okay, normal range is 9 to 14.5. all right. So now we will see the importance of red blood cell indices. So now it can be clear that with the help of red blood cell indices, You can classify the anemia morphologically into the three types: microcytic hypochromic anemia, where your MCV, MCH is low; macrocytic anemia, where your MCV and MCH is high, right? And normocytic normochromic anemia. So you can morphologically classify the anemia, whether you have the microcytic anemia or macrocytic anemia, and accordingly treatment can be planned. The main importance of red blood cell indices is you can differentiate the iron deficiency anemia from the beta thalassemia, right? How? We will see it. So in the iron deficiency anemia, you have the low level of all three red blood cell indices. Your MCV, MCH and MCHC all are low, while in that of thalassemia trait, beta thalassemia minor, you only have MCV and MCH decreased, low MCV and low MCH, but your MCHC is normal in beta thalassemia minor. It's a normal. So in this way you can differentiate the IDA from the thalassemia trait. And you have to remember, guys, that in thalassemia minor you have the increased red blood cell count. This is the most important MCQ. Although you have the anemia, your RBC count is increased only in one condition, that is thalassemia minor mainly, right? So this is the classification of anemia based on red blood cell indices. The based on MCV, it can be divided into microcytic, macrocytic or normocytic, and based on MCHC, it can be hypochromic or normochromic. So guys, when you have the normocytic normochromic RBC, we have seen all causes of microcytic, macrocytic. But when the size and the hemoglobinization all are normal and still you have the anemia, that is in case of an aplastic anemia or in hemorrhage and the hemolytic anemia. In these three conditions, you can have normocytic normochromic red blood cell. So guys, this is a master figure of red blood cell indices in various anemias, right? As we have discussed, in case of an microcytic hypochromic anemia, that is IDA, anemia of chronic disease and thalassemia minor, you have the microcytic hypochromic anemia, so all these three indices will be low. But the differentiating point is with the red cell distribution width, that reflect the anisocytosis of your RBC, that is variation in size of red blood cell. So that will be increase in iron deficiency anemia. And in the thalassemia minor and anemia of chronic disease, it can be normal. Usually in thalassemia minor it is low, but it can be normal as well. So if your RDW is increased, then you can differentiate that it is a IDA, not a thalassemia minor. And again, second point is in thalassemia minor, RBC count is high. Remember that. Okay. In case of an hemolytic anemia, you have the increased RDW, and MCV and MCHC can be increase or decrease according to the different cause. Okay guys. In the aplastic anemia and in the megaloblastic anemia, obviously your MCV will be high because you have the macrocytic red blood cell, right? And your RDW will also get increased. But the MCH, that is the hemoglobinization, is low in aplastic anemia and it is a high in case of an megaloblastic anemia. So that is again the differentiating point. Okay, so guys, this is all about the red blood cell indices. We have discussed all aspects of MCV, MCH, MCHC and the red cell distribution width. Now we will see some of the case series. We will see some of the case that can be asked as an MCQ. Okay, so case 1. 25-year-old lady presented you with the tiredness, fatigue. His CBC report was showing low hematocrit level. Okay, MCV is low. You can see that it is a 65, so it's low. Red blood cell count is increase. MCHC borderline. We can say that it is borderline low. RDW is within range and serum ferritin is within range. What is your diagnosis? So here the important point is hematocrit is reduced. So you have the anemia, right? Okay. You have your low MCV level. So obviously you have the microcytic anemia. So your diagnosis is microcytic anemia. But still we can proceed further. Your red blood cell count is increased. It is 5.5, right? The red blood cell count is increased in case of an thalassemia minor. So your final diagnosis could be beta thalassemia minor. So we have reached up to the diagnosis. So in such way you can reach up to the diagnosis. It is a case of microcytic hyperchromic anemia, but still you can give further diagnosis with the help of this indices, right? Okay. Second case is 70-year-old male, recurrent mouth ulcer is there. You know, this mouth ulcer is classically seen in B12 deficiency. That's a clue. Your hemoglobin level is low and MCV is high. Rest of the features are normal and MCH is increased. So remember the cause for increase MCV and increase MCH. It is seen in case of an macrocytic anemia, particularly megaloblastic anemia, particularly B12 deficiency, in which the MCV and MCH both are increased. So it's a case of macrocytic anemia. Okay, third case, CLL patient, 65-year-old male. His hemoglobin level is low. MCV is high, right? MCV is high. MCH, MCHC normal. RDW increase and the bilirubin has been raised. So you know very well that your bilirubin level will increase when your red blood cell will destruct. So red blood cell destruction is seen in case of an hemolysis, right? And your hemoglobin level is low. So this is the case of hemolytic anemia. So you have to run the panel for hemolytic anemia. You have to rule out the cause from the hemolytic anemias. So that was a case of hemolytic anemia. Okay, fourth case, 30-year-old female. Hematocrit is low, MCV is low, MCH low, MCHC again is low. You have to remember all the normal range for the MCV, MCH and MCHC. Then you can diagnose the case, right? MCV normal range is 80 to 100 roughly. So your MCV is very low, right? The hematocrit is also very low, right? And your RDW is markedly increased. So when you have the all red blood cell indices decrease, right? If all three basic red blood cell indices decrease and RDW increase, that is the case of iron deficiency anemia classically. This is the most important MCQ, guys. Remember, when you have the low MCV or when you have the low MCV, low MCH, low MCHC with increased RDW, then surely it can be the case of iron deficiency anemia, and you have to investigate further with serum ferritin and iron tablet need to be given. According to severity, the medication has to be given. Okay, case 5, give the diagnosis. So here you can see that as compared to lymphocyte, your red blood cells are decreasing in size, right? And the central pallor in the RBC is also increased. So there is also presence of hyperchromic RBCs. So this is the case of microcytic hyperchromic anemia. Particularly it can be iron deficiency anemia. So it's a case of microcytic hyperchromic anemia. So guys, thank you very much for hearing. This is all about the red blood cell indices. If you like my video, then subscribe my channel and press the bell icon so that you can get notified whenever I am posting the new video. Thank you very much guys, and see you soon in the next video. If you have any further question, then you can ask in the comment section. Thank you very much.